Eating disorders, as with many mental illnesses, often present first in children and young people. And like other honourable members, I've been alarmed by the NHS England statistics that show 12.5% of 17 to 19-year-olds in England were living with an eating disorder as of 2023. According to Young Minds, and this is a quote, young people often use their behaviour around food and eating to try and cope with difficult thoughts, feelings and experiences. Over time, these kinds of thoughts and behaviours around food become very fixed and difficult to change and may start to take over daily life. End quote. So early intervention for a young person struggling with an eating disorder is clearly critical if we want to support them to live healthy, fulfilling lives. I was politicised at school by the disparity in mental health support received by my peers. And we know that young people today are at the sharp end of the mental health crisis, and I too have had friends that have struggled with eating disorders and disordered eating. And during the general election last year, I was contacted by a young woman who'd waited 4 years for her first CAMHS appointment. And sadly, this has become the norm, not the exception, for young people with mental illnesses. I welcome this government's commitment to cutting NHS waiting lists and investing in talking therapies. And I also welcome the commitment that this government has made to getting mental health support into our schools, delivering a network of Young Futures hubs with trained youth workers and drop-in mental health support so that we can address eating disorders early, mental health conditions and support our young people. I do have a few specific questions for the Government Minister, which I'd be grateful if he could address in his response. Firstly, could the Minister set out what the Government is doing to improve the early identification of eating disorders? For example, Place to Be in 2023 called for every professional worker with children and young people, including in the healthcare workforce, to be trained to identify young people with potentially impairing eating behaviours, and I wondered if the Department had considered this. Given the huge impact of the pandemic on the mental health and well-being of young people, could the Minister set out further what action the Government is taking to specifically support individuals who developed an eating disorder and mental health condition in this time? And finally, could the Minister set out what cross-departmental work the Government is undertaking to make sure there is a joined-up approach to support young people with eating disorders across government? Those struggling with eating disorders deserve support and they need action, and we must treat eating disorders as the emergency they represent. And I was moved, particularly by the Honourable Member for Bath's comments. Given her important work on this issue over a number of years, the frustration seeing this get worse, not better. I would reflect on that from my experience as a young person going through school, watching my peers struggle with eating disorders and mental health conditions, and now coming into this place to represent my community, knowing that young people today are struggling so much more. And I think that makes the urgency of this task even greater. So I thank her again for her work and for securing this debate. Thank you.